So today's topic, we're going into different categories of nursing. There's so many things you can do with nursing.
So many.
The field is huge. Okay, so we're going to break down each section into categories, job descriptions, into the education required for each type of description, licensing, and salaries. So yes, we get to talk about the money.
We are going to talk about salaries. What are these people making? And we're not just going to be talking about registered nurses. We're going to be talking about the LPNs, the RNs, the nurse practitioners, and our nurse educators out there.
Yes.
So we're going to make sure we hit on every single category for you guys and give you the details. Again, we do the research.
So you don't have to.
Exactly.
So we got y'all.
So if you're interested in learning more about this topic, if you're a new nurse, curious on which path to take in your journey, or you're just curious, stay tuned. Because we're here to tell you.
What's up, you guys?
Hey guys, welcome to Nurse Talk. We're two nurses keeping it real with all things nursing.
We're kicking this off with the LPN, the licensed practical nurse. So as far as job description, they give basic medications, they give nursing care, they help patients with their ADLs, also known as activities of daily living, which is your washing, getting dressed, feeding yourself, things like that. And then they report the status of the patient to the RN or the doctor.
Right. And as far as education goes, it looks like for LPNs, you have to take a year program. Now, this is either through a technical school or community college. You take that year program, and then after that, once you pass that program, you'll be eligible to be taking the NCLEX PN exam. Now, this is a state exam that will give you your license and allow you to practice once you pass.
So what exactly do LPNs make, Kim?
All right, are you trying to talk about their money?
I am trying to talk about their money.
So the national average for licensed practical nurses is $48,000 a year. All right, that's the salary you're looking at. The top 10% there are making $63,000, and the bottom 10% are making $35,000. So I guess the top 10 are putting in the overtime, right?
Yeah, they're putting in that OT
to hit that
getting
63.
that money.
I'm sure.
Okay.
I'm sure there's LPNs making more than $63,000.
Oh, I'm sure.
Because we're getting all our facts from the Bureau of Labor Statistics. So if you have any other salary out there, let us know.
Yes, give us some insight in the comments below.
So next, we're going to talk about our registered nurses.
Yes.
All right. So we're talking about us. We are RNs, right?
Yes.
So what do we do?
So there's a whole bunch of stuff we do. So we administer medications.
Right.
We treat patients. We coordinate patient care. We do diagnostic tests. And we analyze results. We educate patients. Education is huge. We also oversee other workers like CNAs and LPNs, aides as well for home care services.
Right.
And then we report status of patients to the doctor as well.
Right. So for nurses, RNs, there's 3 different routes you can take. So you can either go in with the BSN program. That's a bachelor's in nursing program. That's a 4-year at any university. Or you can go with your associate's degree in nursing. Now that's a 2 to 3 year program, and not really as common.
Not in 2021 as much as the diploma nurse.
Right. That one also is a 2 to 3 year program, just like the ADN or the associate's degree nursing program. But I haven't seen any diploma programs out there, at least in my area.
Yeah, we really haven't seen any. They're kind of shying away from diploma nurse. And then there's also bridge programs. So you can have an associate's degree and then move on to your bachelor's degree. Usually online, you can do a lot of them. So it's something that a lot of people do.
Let's get down to the money. How much are nurses making?
So as a registered nurse, straight out of school, you're looking at about $58,000 to $74,000 per year.
Right. So now we're going to break it down. The top 5 states where you can earn the most money as an RN. Which states are those?
So California, we're looking at about 100,000.
We knew this though.
Yeah,
Cali's
basically.
always making the most. The most.
Yes, the most. Hawaii, about 98. So if you want to do a little, aloha out in Hawaii. Massachusetts, we're looking at 92,000.
Right.
And Oregon, 91,000. And then Alaska, the Great Frontier. Is that what they call it?
I don't know.
All right.
I have no idea.
So yeah, you're looking at Alaska, you're looking at about 89,000. But what about the lowest states, Kim?
Oh man. So top 5 or the not so top 5.
Not so top 5.
So the top 5 states that are earning the least in the nursing practice are starting with South Dakota at 58,000, Mississippi as number 2 with again 58,000. You have Iowa and Alabama at 59,000, and last you have Arkansas with 60,000. So guys, we're getting all our information from the Forbes website. They're the ones that provided the top 5 and the least 5 for us. So this is what they're saying. If you guys feel like you're earning way more or way less in your state, I can't imagine now that you're earning any less with the pandemic that's going.
Oh yeah, because people are making way more with incentive programs and travel nursing and things like that.
Right.
So I'm sure you guys are making more.
All right, guys. So now we're diving into our NPs, our Advanced Practice Registered Nurses. So they provide and coordinate patient care. They diagnose and treat illnesses. The master's level education qualifies them enough to do their care on an autonomous level. They are able to take care of patients outside of collaboration with the physician in some states, which is awesome. The nurse become doctor in the sense, right? So what is the education process for a nurse practitioner?
So as far as education for the nurse practitioner, you can go either route. It can be a master's program or it can be a doctorate program. So the master's, you're looking at a master's of science in nursing, or the DNP, you're looking at doctorate of nurse practitioner. And for the DNP, you're obviously looking at a longer amount of time. You're looking at about 4 to 5 years.
Right.
Whereas with the master's, you're looking at about 2 to 3 years. And like I said, depending on like whatever program you're in, it can vary how long. There's part-time programs, full-time programs, so it depends on what your school offers. You're going to go on to taking your board exam.
Right.
So this is where it gets a little tricky because depending on what your specialty was, that's the exam you sit for. So you take that exam and then you go on to become an advanced practice nurse, depending on what your specialty is.
So what are the specialties?
So there's several of them. There's family nurse practitioner, which I am.
Okay.
Yeah. There's the psych nurse practitioner. There's geriatric, which, fun fact, is 13 and up as far as age.
I don't know about you, but I ain't no geriatric. Okay.
I was surprised when I heard it too. There's acute care, so you can work in a hospital setting. There's women's health. There's the CRNA, which deals with anesthesia. And then there's pediatric NPs as well.
Okay. So again, as an advanced practice nurse, you can do a lot. So let's talk. What are these NPs making out here?
So NPs in Cali are making the top dollar, okay? So they're making about $130,000 per year on average.
You ready to go pack your bags now? You trying to go live
Cali
in Cali?
weather sounds pretty good.
Right?
I mean,
for that pay, it does.
For real. And then we're looking at Alaska. I don't know if I can do that one. But that's about $120,000 a year on average. And then with Massachusetts, New Jersey, and New York, we're looking at about $120,000 on average.
All right. So they're saying for MPs, the national average is $110K. So that's $110,000 $1,000 that you can make as a nurse practitioner. We're going to talk about our nursing educators.
Mm-hmm.
You know, shout out to our nursing educators because we would not be here without you.
That is true.
So let's talk about that. So the nursing educator has to go through a master's program. Now, these master's programs normally take between 2 to 3 years, again, depending on your lifestyle. This could be longer or shorter, depending on how you take your courses and what your university offers. And with that, you are making between 80 to 90K a year with that master's in nursing on average.
Exactly. With any of these job titles, you can basically make more money depending on overtime,
Right.
incentive programs, bonuses,
Right.
all kinds of things. So, you know, these are not caps. Like Kim was saying, these aren't caps to what your salary would be. These are just the national averages.
Right, right. So don't see this as a ceiling, but see this as a starting point because nursing is a very rewarding field. I know the demand has been crazy lately.
Oh, yeah, definitely.
Because, I mean, we're needed. You know, all nurses are needed. All hands are needed. So, yeah, we hope that this information kind of gets you guys a little bit excited about your transition or gives you insight about the nursing field.
Yes.
And if you guys have a different experience as far as new grad pay and your RN pay or your LPN pay, if you're making more than these averages, let us know. Because people in your states, in your area, they want to know, like, how much can I potentially make in this field?
We'll leave our sources down below as we always do. If you like what you saw, give us a thumbs up. And
Subscribe, maybe?
subscribe, share, come
Yes.
back.
Yeah, so we look forward to seeing you guys again, and hopefully you guys like the information we shared. If not, if you feel like we need to touch on some other stuff, let us know. We're open to everything. All right? So I guess this is Nurse Talk, and we're out, right?
Yeah, we're out.
All right. Thank you,
See
guys.
you guys.